Welcome to Tartu University's Demo Day. Today, we have speakers from two proof of concept funding and Tartu University's spin-off program. There are many presentations about how to accelerate smart economy. We are waiting for your questions in the Zoom chat, and let's begin with our first presentation. Welcome, Hanno, Ohvril, and the stage is yours.
Dear colleagues, ladies and gentlemen, I am Ohvril, University of Tartu, Institute of Physics, and I am going to talk about Omniton. Omniton is a small, portable, handheld medical device for non-invasive determination of biomechanical parameters of soft biological tissues. These parameters are stiffness, elasticity, creepability, mechanical stress relaxation time, and so on. Current status, technology readiness level, TRL, equals to 4. Where soft tissue monitoring is needed? It is needed for monitoring of joints, for monitoring of possible tumors, for monitoring of skin diseases, and for monitoring of various pain in various locations, for example, because of sport injuries. And Omniton gives the physicians additional information to formulate diagnosis. Omniton, how it looks like. It has precision actuator, it has digital cameras, 2 cameras, it has axis position sensors, in total 6 sensors. And advantages of Omniton: it is non-invasive, it is less expensive than mRNA or magnetic resonance imaging, less expensive compared to ultrasound, and Omniton gives almost exactly objective results on its small screen. Competition: no other devices on market, and this device has patent, is defended with patent in the IPC system. Global soft tissue repair market is evaluated now $21.5 billion, with a yearly increase about 5.5% each year. And the fields where this kind of monitoring is needed is from problems of rise in obese population, increase of sport-related injuries, is monitoring of recreation therapy, monitoring of aging, etc. Current status of Omniton: we are on level TRL equals 4, and our final destination is to reach the level 9. Here we see an example how Omniton analyzes a test body. And on the right-hand side, we see damped oscillations, which contain a lot of information inside about properties of soft tissue. International collaboration to this moment. We have close cooperation with a university from United States, the Vanderbilt University, and they are interested in starting medical trials as soon as possible. What do we need to do next? The most problem is to find money, to find funding, and to make 2 steps from TRL 4 to TRL 6, we need at least 200,000 euros. The key persons in this project are Arvi, who is a generator of ideas and has several decades of experience, and Tanel Ainla, who has experience in commercialization of scientific research. And slide 12. Thank you very much.
I see there are no questions at the moment. You can type in your questions in the Zoom chat if there are any in the audience. But I guess not. So thank you very much for coming. And thank you for this very interesting.
Thank you also.
Yeah, and we will begin with our next speaker soon enough. Next up is Hõrak, and he will be talking about smart sensors for automatic direct observation of physical activity. And continuing with this theme. And if you're ready, you can come and join me on the stage. Just a moment.
Dear listeners, my name is Hõrak, and in collaboration between the Institute of Social Studies and the ICV lab at the Institute of Technology at University of Tartu, we have been working on a new method for measuring physical activity. And why would we even consider measuring physical activity with a video camera if we have all these fancy wearable sensors which give very precise information about the person's physical activity? Well, one reason is that for individual level measurements, you have to intrude the privacy of the people you're studying, and you have to obtain ethics review, and you have to be very careful with data protection. But on the other hand, observation has been classically also unethical because it's unethical to stare at people. So what we suggest is we use computer vision and machine learning to observe the people without the researchers or anybody at all seeing any of the visual information. This would allow us to preserve the privacy, yet get the observation data. And we have developed a real-time video analysis sensor, which is built on a small single board computer, where essentially light goes in one end, 2 seconds worth of light, and there are several neural networks and algorithms which process this video, and as the output we get the physical activity classification for the people in the field of view of the camera. And with this project we obtained a data set from 24 children, and the annotations all together make 12 hours of data, and we managed to get the whole pipeline of physical activity detection to perform around 0.66. It's a ballpark estimate. We haven't very thoroughly studied its performance yet, but so far we can tell that we still need more training data to achieve this research-grade accuracy. And this is also what we are kind of looking for help with and partners. And here you can see the actual first blind observation data we obtained from this sensor. So this is 5 days worth of physical activity observations in one location here in the Delta building. And this is where we look at 5 days in a week. So this is just 5 days worth of data from one sensor. But our goal is to eventually find 2 schools of similar size and similar number of students, and we put up these sensors in both of these schools as a distributed sensor network. And we're not measuring for a few weeks, we are measuring for at least a year, ideally 3 years, so we can get the seasonality patterns, in physical activity behaviors, and we can try out different intervention tricks which are supposed to make the children move more. So, but this is still far from this where we can go now, but we are certainly open for any collaboration or investors or anybody who's interested in developing this observation method. Thank you.
Thank you very much. And are there any questions about this theme? You can write them in the chat. Doesn't seem to be any, but thank you very much for this very interesting talk.
Thank you.
Thank you. Next up is Hanno Evard from Silklytics, and we will see the solution of a complex analytical chemistry technique. So we are going to see how the problem solving is with high price of complex analytical chemistry techniques. And although the analytical methods with lower prices exist, their analytics performance is very low. So how to keep up with very high quality analytics and also with a price that we can afford and that scientific methods, scientific accelerators or incubators could afford, and how to develop them. And their solution to this is the novel microfluids technology that they are developing. And before that, we will have a soft robotic cervix for simulation training. And we will see how the soft robotic cervix is improving. And if you're ready.
Okay, cool. Okay, hello everyone who are watching, I'm guessing online. So I am Mona Küüts from our startup called Soft Robot. And today I will be telling you about what we are doing. And in very brief, I will talk about a soft robotic cervix for simulation training. So lately, given all the circumstances that have happened in the world, simulation training is gaining more and more popularity. So there isn't, it has expanded to the size that it isn't anymore just simulation training schools, but there are whole simulation training hospitals. And if in a school you have the simulators and students and instructors, then basically it's the same at the hospital, but it just over there are patients and doctors. And I think lately we can all imagine that given the COVID situation and all of these things that have happened in the world, we would really benefit from simulation training, as we don't really want to have maybe sometimes too much contact with the real life patients. So for one example where simulation training is used is in midwifery. So for example, they have these birth-giving simulators that they use to simulate the birthing process. So these robots already exist, but when we look at this technology from the robotics perspective, this technology has been outdated for like already 20 years. So what we would like to do is to use the existing simulation infrastructure that already exists, but to incorporate our own more modern technology into this existing infrastructure. So we are looking to develop a new soft robotic cervix. So for that, we are looking at the anatomy and physiology of the human cervix. And we are taking from technology side the variable stiffness, anisotropy, and also using high relative deformation. These are all good beneficial technologies from soft robotic side, and we will combine the technology with the anatomy, and then we will achieve this artificial cervix. And on this video in the center, you can see the reversible opening of our first prototype. So our product is the soft robotic cervix. It's compliant with the existing platforms. Our business model is business to business, and our price formation comes from the sale and the maintenance of the mannequins, also sale of the consumables. So any parts that would wear out in the learning process more easily. And we are considering licensing, but that is our smallest priority right now. And then our market is the healthcare institutions in Europe and in the United States, which means it's the public sector. And this is our team. We have 3 shareholders who are all active in this company right now. We are at the moment also taking part of the healthcare technologies scientific accelerator. We got accepted into that. So right now we are trying to reach from TRL 4 to TRL 5 by the end of this year. And if you have any questions, then you can see my contacts, or I can answer some right now. So thank you very much.
Yeah, so leave the answers in the chat if you have any. Currently doesn't seem to have any. Okay, so I have one question myself. When will we be seeing these devices in use? What is the prediction?
The most optimistic prediction that I would give is like maybe 3 or 4 years.
Wow, that's quite soon, actually.
Yes, we are working towards making it the process as fast as possible.
Yeah, that's very interesting and a big step for women in the future.
Yes. Okay.
But thank you very much for coming today.
Yes, thank you.
So what is an event without a hiccup? Before I was talking the introduction about Silklytics, but we are here today and here now with the Silklytics performer, Hanno, Evard, and join me here. Yeah, stage is yours.
Thank you. Hi, I'm Hanno from Silklytics, and the problem we're working on is that climate change is really increasing food shortage around the world. So how do we solve this? What we actually do is we provide a service to help farmers avoid loss of crop with our novel nutrient test. So how does it work? It's really an analysis platform that is enabled by our proprietary microfluidics technology. So the microfluidics technology is really the key here. This platform is developed right now, so it could analyze nutrients. Another aspect here important is that the analysis is really simple to do, and the results are give high performance. So how are we different from existing solutions? We really compare to existing simple low-cost on-the-spot tests. We are way better in performance, like sensitivity, selectivity, which means we can measure more different compounds that are necessary. And compared to lab services that exist right now, we're more simple compared to those. So what that means is that it brings the cost down and gives the farmer greater speed to get the results, which is very important, since otherwise the plants might not get the fertilization that they need fast enough. So our go-to-market plan is that at first we will start in Estonia with one partner lab. This will give us the proof of concept on the technology side. And from there, we will go to the Baltics market. We will be marketing these devices to cooperatives, retailers and labs, so not farmers directly. And this politics market will give us the proof of concept for clients and market side. So from there, we can scale to Europe and US. But the key here is that really this nutrient analysis from the technology side and from the market side is really a stepping stone for all kinds of different fields that we can expand to from there, like measuring nutrients and vitamins from food and clinical samples. Really, what we have is this microfluidic platform with huge market opportunity. So business model is we are a B2B based subscription business model. With a subscription, you will get the chip and the reader for analysis, and you will also get a cloud platform that stores and helps you interpret the data. So traction so far, the product prototype is ready. The specific applications for nutrients are further under development. And we are already patenting our technology. The draft is being written for by the attorney. From the market side, we have confirmed interest from these large agriculture companies here in Estonia. They obviously have interest in this, and they see that there's a need for this kind of a system. And we have grant funding left for at least for 1.5 years. But in a big picture, as I said, this nutrient analysis is just a stepping stone in technology and market. So we can go to food and clinical, environmental and forensics and so on, and many different areas, which gives us a huge market opportunities. And of course, there we will have different business models depending on the application. So it might be B2B or B2C. We have 3 core members, 3 founders, me, Irene, and Indrek. We're all scientists with a little bit different backgrounds. However, me and Irene are working more on the business side as well. Indrek is the technology side. We have 2 more students working in our lab also, as we are a research group. And thank you, that's it.
And now, if you have any questions, you can write them in the chat.
Yes, I can show you here. This is what the chip will look like, and this is the reader. And you can put the reader into the chip, so you can make the analysis like that.
Wow, that's some prototype. So thank you very much for giving this speech today and letting us know about the future opportunities.
Thank you.
And solving this complex funding and quality research milestones and stuff you have come over. So what are the biggest milestones you have faced this far?
This far, I think the biggest milestone was getting the grant funding and building up the team. So that was the where we started 2 years ago. And from there, we've been slowly developing the technology and learning about the market. So it's more incremental development there. Okay,
well, thank you very much.
Thank you.
And our next speaker will be here in a second. And from molecule analyzing to how robots can teach our children to communicate. So welcome to the stage, Anneli, Kolk. And the stage is yours. I will hand you over this. Yes.
Hello. I will introduce today your future therapist, humanoid Pepper, and how we deployed next general technology in pediatric neurorehabilitation. But why about talk about this topic and to research? As we know, mental health is a big problem and it's a growing problem. And on this slide, you see the national data of school children feeling depression and sadness, boys and girls, and our children is in leading position. Why is necessary? And mental health problems is connected poor social skills, and why it is necessary to develop and to recognize social deficit and understood with problem. And solution is early detection and training social deficit in children. And as we know, it was found almost 75% problems start in childhood before 24 years. Our research team mission is to develop social skills in a new innovative way, and developing and implementing new digital solution, humanoids, for child and adult-centered medicine. And the concept of social robots appeared only recently. Communication with humanoids is similar to people and child-to-child communication. Robots is preserved as an equal companion, and robots are not living things, but people, including children, could preserve robots as lifelike beings. Today is different humanoids, as you see here, but our Pepper is most similar to child. And robots are designed to engage, fascinate, and to keep working humans for effective communication, give our beneficial ways to interact and develop communication skills. And it is a new positive era in neurorehabilitation, we think. And Tartu University, we use Robot Pepper. It's a childlike humanoids and a program for controlling behavioral and communication models. Also, we use neural speech synthesis technology, neurokõne, text-to-speech solution with synthetic children voice to do this work. And also we do research to get evidence-based data of this rehabilitation work. Pepper in therapeutic process now is able to help children learn verbal and non-verbal communication skills, encourage a child to start conversation, understand and recognize emotion, train speech and vocabulary. And also what we find, which is use distraction instrument to decrease children's hospital fear and stress. And our success, it is very good what children quickly made contact on interaction with robots. It takes only a few seconds. And we found that children became more communicative at home, school and kindergarten, use new verbal expression and non-verbal skills, louder voice, eye contact, more emotions. And social robots help children keep to focus on the learning process. Because traditional rehabilitation methods are repetitive and more time consuming. I do find that using social robots in neurorehabilitation would make the therapist work more effective and less time consuming. Also in speech therapist. Here you see we work a little bit for future for elder people. It also possible to activate with elder people, activate their communication, activate their cognitive skills and rehabilitation work. But you can't do with robot voice, but you can read what is doing here. It's remembering what's remediation is done, how to go to garden and where to get better emotion. As you see, it's unfortunately you can't heard with special nice Pepper voice. So with development needs cooperation, different specialists. and experts, and we work in Tartu Children's Hospital with speech therapists, also neurologists, psychologists, and our team is also robotic research workers and also technical speech work and computer science. And we thank you for attention, and it is our next therapist to help us.
Thank you. And do you have any questions in the chat, listeners? You can type them up right now so we can answer them. None at the current moment. So thank you very much for the speech. And I have a question myself. The SARS virus has made our whole environment more vulnerable to communication, lack of communication. And where did this idea become of making this tool?
Yes, you know what's child rehabilitation need, what it is funny, it is motivating and something new, attractive and new techniques. And when I saw in airport with robot, I say, why don't we use this in nice purpose and train, because children very quickly take contact and they love it, say, it's my friend and I come back, and it is really, you can train special topics and how behave, also many with educational works, and it helps speech therapists also.
Oh, very cool. So will we all have a robot in our homes teaching our children to speak?
Or do we rent a little bit, but it is need also therapists to support and direct with children, because we have children from 5 years and they need a little bit direction and guided.
Awesome. Well, thank you very much and for coming. And we will take a small break here. We will be back at 11:40 and with our next talker, Margus Varjak. So see you then. So welcome back. Next to me, I have Margus Varjak, who will be talking about testing of antivirals in the COVID tests, COVIDs. So the stage is yours.
So hello, everyone. I'm Margus Varjak, and I'm Associate Professor in Virology and also the scientific lead of the core biosafety facility at the University of Tartu. So I'm on the bit on the background. So the virus we shall not name hit the globe in 2019, 2020. And when the world shut down, what happened was like everything else shut down except the virologist. So for us, it was a busy times. And these were also the busy times at the University of Tartu as well. So instead of just lying on the couch and watching TV, for us, it was a busy times. And so what happened was that we started applying for funds from the government to have our own BSL-free laboratory established, to have it fully equipped, which is in some ways, it's a bit insane in the middle of pandemic when you have to start doing public tenders, hire people, writing SOPs, but we succeeded. In a year, we had a lab ready to go, and the lab is actually fully equipped. It's a special lab. It's the state-of-the-art research laboratory, the unique one in the whole Baltics in generally. And what we can do there is we can study all BSL-free class viruses. For example, we already have SARS-CoV-2 research established. We can do HIV, we can do hepatitis C virus, but others as well. We can do alpha viruses, flaviviruses, and beside viruses, we can actually do also bacteria. It's not just virus work. So within a year, in the middle of pandemic, we had everything set. And beside, we can also do animal work, including mice and rats. And what's even better for us in that sense is that the laboratory is fully equipped. It's we can do qPCRs, we have late readers there. We can do live monitoring of infection. We have a fluorescence microscope for that. We have late reader for that. And most importantly, the laboratory is designed in a way that we could do drug screening as well, which is especially important that the virus that shall not be named is still around us and it's not going away anytime soon. And so on the projects, what we've already been done has been testing drugs, of course. We have been doing surface testing. We have been testing materials. We also been testing different UV sources. I also have plasma testing. So which all would permit us to kill the virus and to have safer and better lives. And so some of the tools that we have already established in that sense is that we have taken the SARS and we have modified it. We can, of course, work the wild type virus as well, but we have modified it. And in that sense, what we have done, we have made sure that it can express either green or red protein, or it can express also non-luciferase that allows the light emission, which it's anyways makes it ease of quantification. We can do rapid drug screenings and allows us infection monitoring, essentially in real time, which has actually allowed us to do it very fast, rapidly, and has been quite successful, which is in many ways beneficial. And of course, if we get a drug hit, we can go back to the wild type viruses. And it's not just the Wuhan strain, we can also have the same for other strains as well, like Omicron. And so current aim is that, yes, we have the BSL-free laboratory established, but what we have a know-how for plasmid molecular cloning, we have a know-how for virus work. But in many ways, the future aim would be to establish again like a more safer and faster system for drug screening. That's not for us, but for outsourcing in many ways as well. We have already replicons established, which means replicons are almost there, but replicons lack the structural gene. So we cannot recapitulate the whole replication cycle, but for the future goal would be to have established cell lines that would help to produce the virions. It means that cell line itself is expressing the virus structure proteins. It means that if we put replicon there, replicon gets packaged, we can produce the virus particles that resemble 100% actually the real virus particles, which would actually be much better screening tool, especially in the safety regard, which can take things forward. And it means that, yes, from BSL-3 to BSL-2 back again. So, and thank you. And any questions, always willing to answer.
So any questions you have, please leave it in the chat. None at the current moment. So I guess it's a hard theme to try to guess questions. But thank you very much for this talk, and good luck with all the progress and the biggest milestones that you have faced and will probably face. So maybe you can talk about one of the biggest milestones you have faced so far.
The biggest one was actually getting the furniture from Italy.
Oh, okay.
So it might sound funny, but it's like equipment was easy, but getting like the last piece of furniture was stuck in because there was the middle of the pandemic. So, but
yeah.
Well, on the other hand, it was a minor obstacle. So in many ways, it was actually very rapid and a very fluid process to get it going. So we have people working, SOPs and everything is set. So in that sense, the people trained. So it's just like full on.
Okay.
From May last year.
Oh, wow. That's a long time.
Yeah.
So the pandemic, it's quite an inspiration for your field, I think.
Yes.
So it's a way of to improve your science field. So what is some of the things that the pandemic has taught your field?
So one of the things it's, I mean, for virologists, it wasn't that much of surprising. We knew that the pandemics can happen anytime. But I think the biggest was actually that the public acknowledged the fact that the world is changing, there is a globalization, there is viruses are jumping from ecosystems to humans. And that was, I think, that was the biggest change in that regard. I mean, we still have some minor outbreaks. For example, we have like the Zika outbreak some years ago. Now currently we have like a small monkeypox outbreak. So, but it's all kind of says that this is actually important to focus on these areas as well.
Okay, so you were prepared.
we were mentally prepared.
Mentally
yes.
prepared.
Mentally prepared. Maybe not that much physically, but we now are physically also prepared. We can do such research.
Okay, we are very thankful for your presentation and all the work you've been doing that will help the society in the future as well.
Yes.
And thank you very much.
Okay, thank you.
So the next talker we will have today will be from Gearbox Biosciences, Arvi, Jõers. And welcome to the stage.
Hello.
And the stage is yours.
Is it on?
Yes.
Okay. Thank you. So hello, everybody. My name is Arvi, and our company is called Carebox Biosciences. So the big problem we want to address here is how we, as a society, get our chemicals and materials that we need. A traditional way is to use oil and convert the oil to other stuff by chemical synthesis, but needless to say, this is more polluting and not sustainable approach. We can be more clever, and we can use actually living cells, microbes, to do that. So this is our company got started a little bit more than a year ago. We are a spin-off from University of Tartu. And since then, we have joined the local science to business incubator. We have reached the grand final in pan-European startup competition. We released our MVP, minimal viable product. And since then, we have been doing small feasibility studies with prospective clients. So we have invented a new technology that makes production of chemicals in bacteria more efficient. I'm not going into the technical details here, just saying that we can precisely control how bacteria grow and how they produce what we want. And this gives us the efficiency. And our switcher technology is protected by patent application. Another technical development that we are doing right now is to make bacterial protein production free of antibiotics. Usually antibiotics are needed for high yield production, but as probably you all know, there are several societal issues with high use of antibiotics, including the spread of resistance and so on. And now we have an old technology in development that enables to avoid antibiotics in production while maintaining a high yield. So to be precise, our product is a new bacterial strain that can be used for efficient and antibiotic-free bioproduction. And we will use that strain to produce many recombinant proteins. Our target market are the sectors where the use of antibiotics is inflicting a high cost on producers. At first, we are focusing on food enzymes, which is a $2 billion market, and where companies producing foods actually use those enzymes for their production processes. And inside that market, or just beside it, is a very high growth sector in alternative food, which is basically lab-grown meat. And you need a lot of bacterial proteins actually to produce lab-grown meat. And the other market is pharmaceutical proteins, which is a huge global market. And there as well, the use of antibiotics is strongly discouraged by regulatory agencies. Our business model at first is licensing. So the companies that are producing those enzymes will get the technology for antibiotic-free production from us, and we collect a license fee. But later, we want to become a product company so that we will have our own product and sell it to the end users. And we will choose the product according to the knowledge that we get from the licensing stage. Our team consists of 3 founders. We have all deep technological backgrounds. We are all experienced molecular biologists. But I have also worked as a chief scientific officer at the biotech startup before. And also Maria has some experience from another startup. And last but not least, we plan to raise our pre-seed round at the end of this year. So if you're interested, please get in touch. Thank you.
So thank you. And if there are any questions, you can leave them in the Zoom chat. I guess not. Okay. Well, it's a very interesting theme. Where did the idea of starting this firm begin?
Well, it all sort of sprouted and grew up from scientific research we were doing in our laboratory. So at first it was a purely science project. Then we realized that it can be used practically, or it could have a practical value. And then sort of step by step, we developed the idea that we could actually start the startup based on that.
Wow. So that's very inspiring.
Thank you.
And thank you for sharing this information with us. And
thank you.
For our next speaker, we will have Koit Herodes from ValChrom. And the stage is yours. If you're welcome.
Thank you. Hello, my name is Koit Herodes, and at the Department of Analytical Chemistry, we are developing a software tool called ValChrom, which aims at helping analytical chemists to do their work faster and more efficient way. So the remote is not working. Yes, now it works. Thank you. So there are many analytical methods available, but among them, chromatographic methods are the most important ones when it comes to the analysis of organic residues in difficult matrices. But all those highly sophisticated analytical methods require checking that the method performs as required. It means they require validation. And validation is a demanding task. For validation, there are several guidelines, but guidelines are often quite general, sometimes even giving conflicting recommendations. And usually those guidelines do not specifically address chromatographic methods. In addition to this, validation requires knowledge of quite sophisticated statistical processes, and this experience might not be available in analytical laboratories. Therefore, we created a software called ValChrom, which walks the user through the validation process and automates as much of this process as possible. The software enables validation to be carried out using international guidelines, and it's web-based. Therefore, it's managed centrally, and community can check it for errors, and we can centrally improve the system. We think that the main advantage of ValChrom software is in its workflow, which is built as simple as possible and as automated as possible. It starts from describing the method. So user describes their analytical method. Most of the information user has to provide is for documentation purposes. Then user in parallel has to choose the validation parameters for which to assess the method. It's mostly point and click system, so that user doesn't need to know specifics of those characteristics. In the third step, user creates just a combination of the analytical method and the validation plan. And ValChrom automatically creates an experiment plan. And with this experiment plan at hand, the user goes to the laboratory and does the chemistry. So carries out the experiments. With the results of experiment, user imports the data to ValChrom, and ValChrom generates reports. Reports can be generated at different levels of detail, so it can be customized. With this, we have created ValChrom software, which walks the user through the validation process, enables validation according to 3 major validation guidelines, EUROCHEM, EMA, and ICH. And all this is possible in just 5 simple steps. We think that this chemistry side of ValChrom is already pretty good, and it has been tested by hundreds of students. And we think that it will be very popular once mature enough. What is perhaps a bit lacking is the IT side of the software, which would benefit from further development. And we hope that in this regard, you can contribute to our project. Thank you for your attention.
Thank you. And I can see there aren't any questions at the moment. So thank you for this presentation. And thank you again for coming here today.
Thank you for inviting me.
So our next speaker will be talking about how to make green plastics, and Livia will be here. They are developing solutions for high-tech plastics from biomaterials, because as we all know, the problem of not having reusable packaging has been troubling us all. So you're welcome here on the stage. Thank you. Yeah, and the stage is yours.
So hello, my name is Livia and I'm a research fellow from University of Tartu. And today I'm going to give a brief overview of our work that we do in Institute of Technology. And this is about green plastics. So most plastics nowadays are prepared from fossil resources. Unfortunately, this is not a sustainable approach. So, and according to European Green Deal, new requirements should be enforced to make products more sustainable, more energy and resource efficient, and more easily recyclable. So one good option would be to replace fossil resources with bio-based ones. Lignocellulosic biomass is one good replacement. It consists of 3 different components: cellulose, lignin, and hemicellulose, that all are good resources for new platform chemicals and building blocks for plastics. In our work, we aim to prepare different building blocks from lignocellulosic biomass. And we aim to prepare polymer and plastic materials for the areas that have more demanding goals. For example, in high performance plastics, in engineering, and construction industry, durable coatings, and also packages in more demanding sectors. The goal is to have materials that are suitable for various applications, that are reusable, and also easily recyclable. So on the next few slides, I will give a more detailed overview what we have done so far. So cellulose is semicrystalline polysaccharide that composes of glucose. From glucose, via sorbitol, we can obtain another interesting rigid compound called isosorbate. Nowadays, it is also produced on an industrial scale, as the synthetic route is very well known. In our work, we have prepared different polymethacrylates from isosorbate. This is shown in this blue box on the slide. So for that, we first developed enzymatic synthesis for the synthesis of building blocks, and then we carried out polymerization reactions to obtain the final polymer materials. Generally, all these materials exhibited high thermal resistance and good film forming properties. But what is more, when we modify the functional group marked in red on the slide, then we can also modify the final properties of the material that we obtain. And in collaboration with industry, we have tested these compounds in emulsion polymerizations in paper and cardboard coatings to replace styrene. And additionally, some tests have been made with these compounds as a components in paints. So these examples show that our materials are suitable to replace different fossil-based plastics. Another well-known chemical that can be obtained from sugars is citric acid. We have chemically modified this a little bit to obtain different rigid diols. On the slide, there is one example. And this rigid diol we have successfully introduced into different polymer structures, like in polycarbonates, polyurethanes, and thiolene type polymers. So all of these polymers are with high thermal resistance. They are easily processable. They are also film forming, as can be seen on these photographs, and they have high transparency. Additionally, these compounds have already a unit inside them that can be degraded chemically. Therefore, the final materials can be chemically recycled. The third component of lignocellulosic biomass is lignin. That has a very various structure, but mostly it has aromatic units inside it. So different building blocks with aromatic units can be derived from lignin. And in our work, we have modified some lignin subunits chemically, and then polymerized them and obtained polymeric materials. So this is the most current work we have been occupied with. But the first polymers have also exhibited high thermal resistance, and they are easily processable. And we speculate that they are suitable for thermoplastic materials to replace fossil-based materials. So to conclude, we offer new solutions to replace fossil-based products with bio-based alternatives. And if you think that this topic is interesting to you and you would like to collaborate with us, then please contact us in the Organic Chemistry Laboratory in Institute of Technology or via email. Thank you.
So if you have any questions, leave them in the chat. If not, we will continue. Thank you very much for this presentation. It has been very interesting to listen. And last but not least, we will have Kaido Kurrikoff from mRNA Therapeutic Delivery. And here you go, the stage is yours.
Thank you very much. Good day, everyone. My name is Kaido, and I'm here today to talk about the mRNA therapeutics. Yeah, the pointer is working. So all of you have definitely heard during the past year about two companies called BioNTech and Moderna and their new and revolutionary technology, which is COVID vaccines based on mRNA. mRNA therapeutics are actually composed or built up from two independent components. One is, of course, the mRNA therapeutic molecule, which, by the way, can do much more than just prevent viral infection. And the other component, which is the focus of today's talk, is so-called transport or delivery technology. So we need delivery or transport of mRNA in order to get this therapeutic molecule into the patient's tissues and cells. And without the delivery, the mRNA does not have any effect at all. Finding new and more efficient delivery approaches is currently at the focus of many research groups in the whole world. How is this delivery achieved in today's clinically used COVID vaccines? They contain something that is called the LNP, or lipid-based delivery method. Speaking very generally, these are just tiny fat bubbles which contain the mRNA therapeutic molecules. However, they have one slight problem with them. The LNP, or the lipid carriers, were originally developed in order to target liver and in order to treat liver diseases. In case of the simple medical conditions like COVID infection, this is not a big issue. But by using the mRNA therapeutic entities, we are actually able to treat much more serious and important medical conditions, such as cancer. And when we're talking about cancer, then liver is definitely not the correct target tissue. What we need in this case is deliver mRNA into the spleen. And why this is important in a minute. But what is our proposed technology or solution to this problem? In our lab, in our research group, we have invented a unique peptide-based technology, which these peptides are specifically developed in order to do two things. First, these peptides are very efficient in binding the mRNA and forming nanoparticles, which are depicted in this cartoon graph here. And secondly, these peptides are very efficient in delivering the mRNA specifically into the spleen tissue. So spleen again. In this slide, I've very briefly compared the two technologies side by side. In the right side, you can see the existing LNP, or lipid-based technology that is currently being used in the clinical applications for the COVID vaccines. And on the left side, this is our peptide-based platform. And I'm currently focusing on this green area here, which highlights the biological efficiency, because this is the most crucial differentiating aspect and our, let's say, biggest advantage over our competitor LNP or lipid-based system. As you can see on the right side, the lipid-based systems are very efficient in delivering mRNA into the liver tissue, and potentially they are very good to treat liver diseases. But with our peptide-based approach, we are specifically able to target the spleen tissue, and this is important in order to target cancer. And the lipid development groups all over the world are currently trying to achieve the same transition to transform the lipids from delivering mRNA into the liver from delivering into the spleen tissue. So why is this spleen so important and so desirable target? Spleen is actually one of the immune organs in our bodies, and spleen contains several different types of immune cells. When delivering mRNA into the spleen or spleen cells, we are able to reprogram our immune cells, and we are able to reprogram the patient's whole immune system in order to start recognizing cancer as something dangerous, non-self, and something foreign. And by doing this, we are able to use the evolutionary defense mechanism that we all have in our bodies in order to fight or treat cancer. So how efficient are we with our peptide technology to target this important tissue, spleen? I have shown here a small set of preclinical data from our lab. And in the upper middle section, you can see live whole body imaging picture. This is a mouse model, which and the color scale in this image contains the delivery efficiency of the mRNA by using our peptides. And as you can see, we are very specific in targeting spleen, and we are also very efficient in delivering mRNA into the spleen. And in the upper right side, we have also quantified this delivery efficiency by using comparable reporter models that allow us to compare the technology efficiency as compared to the competitor LNPs, for example. And we can say that our peptides are way more efficient in delivering mRNA into the spleen as compared to the most efficient LNP available today. So my goal here today is find partners who would be interested in lifting modern medical technologies and help me and our group accelerate past this preclinical stage. And my aim is to start planning the clinical experimentation, clinical stages already next year. Here is my contact. If anyone is interested, I'm happy to answer any questions as well. Thank you.
So any questions you have, please leave in the chat for the last time. So none currently, but I do have one question. Have we found the cure for cancer then?
I believe so, definitely.
Wow, that is a big step for us. Well, thank you. And thank you for sharing all of this.
Thank you.
So this is it for the first demo day. And I hope you all enjoyed all of the presentations and all of the knowledge that has been shared here today. Found some maybe future projects to work on, or something to look forward to to use in the future. And a big applause to all of our speakers, and thank you. This has been the Tartu University Demo Day, and this is our way of accelerating smart economy. Have a good day.